Hi, this is Dr. Neil Schwartz. One of the frequently asked questions I get in the practice is, Dr. Neil, what makes your program different than what I've tried prior? Or what makes your program different than what's out there? Today I'm going to explain the differences between Acne Bootcamp and everything else that's ever been done in the treatment of acne. The basic difference between Acne Bootcamp and everything that has come before it is that we are using new products plus a new methodology, and they are interwoven in an intimate way that makes the products and the methodology dependent upon one another. I'll explain in detail. First, let's talk about the products. This illustration shows us the challenges in formulating new acne products that can be tolerated by sensitive skin. The thing is, acne-prone skin is oftentimes very sensitive. So when you try to make an acne product very strong against the acne and the oil, the problem that you have is that it becomes less and less tolerant by sensitive skin. And so many people have tried products that are very harsh and strong, and they find their acne to start to go down a little bit, but the side effects are so high and it's so intolerant over here that they can't maintain the treatment and they have to throw it in the trash. It's not for them. On the other end, some of the more smooth products that feel really good on the skin are not strong enough. And so you have this push and pull between strength and tolerability. When formulating new products, that is the challenge. The way we've addressed that challenge in the acne practice is that we're formulating products that have amplified strength but have a smoothness so that they're tolerable. So we can get as much power into the skin as possible without creating side effects. That's the formulation challenge that has been met, and we do that by adding several organic amplifiers to the active ingredients over here for strength, and we smooth it out over here by changing the base formulation to make it so that the entire formulation is not harsh. We also have several different strengths and several different formulations so that each bootcamp member has many options to choose from if they have ultra-sensitive skin. It's never a problem here, as the entire practice was created for both acne-prone skin that is also sensitive. And if you don't have sensitive skin, it makes it that much easier to treat. That is the product challenge that has been met, and as you'll hear from the many testimonials, our members and our clients love the products and refill them regularly, not just to treat their acne, but also to maintain great skin and to anti-age their skin and to really keep their skin feeling ultra clean. That's the new products. Here's the new methodology. I made this table to illustrate exactly what has been innovated in our methodology here, and I'd like to show it to you one by one. We're going to be comparing doctors, both in office and online, estheticians, skincare products, both bought in the store and online, dietary approaches, and the acne practice. This table will be on the blog for further study, and I'm going to run through it really quickly with you. Number one, enough time with patients. We know doctors have 4 minutes. It's not enough, and that's why many people are failing acne treatment. It's also the reason why the doctor's son or daughter has great skin, and you're seeing the same doctor and struggling with your skin. 4 minutes is just not enough. Estheticians, you'll notice, do have enough time because as they work on people's faces and as they do microdermabrasions and peels and facials and all kinds of procedures, they really get to know their clients, and that can be helpful as well. Products, you have no time with the patient. There's no patient-practitioner relationship, and that's why many people are failing with simple product routines of all sorts. Dietary approaches, again, people are left on their own. I don't recommend dietary approaches in general as a primary treatment, but if you were to go that route, know that, again, you're all on your own, and being all on your own with acne is sometimes failure-prone. In the acne practice, we have an incredible amount of time with each member. We have a video interactive interface, we have an email interface, and we have the phone if needed. Enough visits per month. Again, the doctor's son or daughter, their skin is looking great, but you're going to the same doctor and you're dissatisfied with your skin. Oftentimes that's because there's not enough visits per month, and this is a huge criticism of the entire Western medicine methodology. If you're only seeing an acne patient once a week, once a month, once every 2 months, there's going to be a lot of room for people to slip through the cracks. Estheticians can see a client up to once a week. That's not enough time. It leaves 6 days in between visits where many patients are slipping through the cracks. Products, you see no one, you're on your own, and that's why so many people are failing with them. Dietary approaches, they're not recommended, but again, you're seeing no one. In the acne practice, we are meeting with our members every single day, literally every 24 hours. So there's a new video interaction every single day, and if that video interaction doesn't resolve the concern, there's an email interaction every single day. And if that email interaction doesn't resolve the concern, there's also the phone that's available to completely resolve any and every concern every single day. This check right here makes this program completely different than anything that's ever been done prior. No practitioner, no product, no method has ever had the practitioner meeting with the client or the patient every single day, and it's a huge aspect of Acne Bootcamp that's bringing great results. Convenient. Doctors, you drive there, you park, you wait for an hour. It's obviously not convenient. Estheticians, you drive there, you park, you wait. You have to recover afterwards and be home while your face is all red. It's not convenient. Products are convenient. You can order them online or buy them in the grocery store. Dietary approaches are convenient. The acne practice, both the product and the service, are both convenient. They're done from the home. Seeing the doctor fast. Anyone that lives in a small town knows that a new appointment for a dermatologist can take up to 2 to 4 months. I've even heard of longer waits. It's ridiculous. By that time, you'd scar up your whole face if you had a severe case, and seeing the doctor fast is a huge problem here that everyone knows about. They've created online doctors to try to fix this, but these online doctors are using the same methodology that the regular in-office doctors use. You can just see them sometimes a little faster and a little more conveniently, but they're still using the same old methodology and the same old algorithms. An esthetician, depending on how busy they are, you may have to wait a week to get your appointment set. Products, you don't see any doctor, you're left on your own. Dietary approaches, you're left to your own devices. And the acne practice, you see the doctor fast. It typically takes 2 to 4 days from the time you order to the time that you're engaging in the bootcamp program and starting your treatment to get from point A to point B in the acne practice. Low cost. Doctor's visits are obviously very expensive, but if you have a great insurance, this whole experience can be less expensive, so that has a plus minus there. Estheticians are universally expensive, whether you're getting facials, microdermabrasion, peels, or expensive laser treatments. You're going to pay out of pocket, and it's going to be steep. It's not uncommon for people to pay thousands of dollars per year for estheticians just for their acne problem. Products, they are low cost. You can get them at convenience stores and online. Dietary approaches, they're low cost because you're just changing your lifestyle. The acne practice has now become low cost. We got the home version down from $300 to $240, now down to $140, which is, we'll say, moderate cost. But just recently, we've added the Acne Awareness Movement rebate, which, if you just tell your story by audio and give a crop photo, we got the kits down to $40. And that was a huge milestone that we've been working on for several years. So at $40 after rebate, the acne practice is now low cost. No discomfort and embarrassment. Obviously, when you peel your makeup off or show your naked face to the doctor in the office and in the waiting room, there's embarrassment and there's discomfort. So that's an X there. Esthetician, again, you have to go to their office, pull your makeup off, show your face or show your bare naked face to another practitioner. It's embarrassing. People are uncomfortable, and that discomfort and embarrassment keeps people away from treatment sometimes. It deters people from doing what's necessary. Products, there's no discomfort or embarrassment. You can order them online or buy them in the stores quickly. Maybe a little embarrassing when you check out if they're looking at your face. Dietary approaches are not embarrassing. Unfortunately, they fail many people as a primary treatment, but as an adjunct treatment, meaning a secondary treatment or a side treatment, there's no discomfort or embarrassment there. The acne practice, you can order online. Within a few days you have it. You're getting both the product and the service online. There's no discomfort and there's no embarrassment. Proven new methodology. It should be well known that doctors both online and in offices are using the same algorithm of benzoyl peroxide, retin-A, tetracycline, doxycycline, oral contraceptive pills, spironolactone, Accutane, and now lasers that they've been using for decades. If you get cleared by these things from your first dermatologist, great. And if you don't expect your second dermatologist to be doing something dramatically different. They are using an old algorithm, and there has been a silent epidemic of treatment failure that many doctors are unaware of. Estheticians, they're using the same cleaning out the skin and facial techniques that they've been using for the last 3-4 decades. They're good at clearing out old stuff, but not as effective at preventing new bumps. And that's one of the criticisms with their old methodology, is that prevention always has been and still remains a challenge for esthetician approaches. Products, they're still using the same benzoyl peroxide salicylic acid treatments that have been out for 3 decades. Nothing's changing. As soon as one comes out with a new marketing ploy, the rest all copy it. There's not much new methodology going on with these acne products or these acne systems or regimens. Dietary approaches, there's nothing new here. People have been trying to get healthy their whole life to fix acne. Some fail, some succeed. It's failure prone and you can scar yourself up while failing. The acne practice has a completely new methodology. The daily interaction plus the new products interwoven into enough time with patients, and you see the doctor very fast. All of this is the methodology. All that you're seeing here is the new methodology, including hundreds of new video tutorials for applications of products that are used in ways that have never been used before. There's a new methodology for the way we see people, there's a new methodology for how we use the products, and there's a new methodology for which products we use when. There's new methodology at every corner in the acne practice. That's why we're having such success as seen in the video gallery. Now, speaking of efficacy, confident with cystic acne without pills. The doctors are not confident to treat cystic acne without pills, and in fact, they would recommend not doing it because they are unable to do it effectively and efficiently. Estheticians, some are able to do it and some are not able to do it, but either way, there's not a confidence that they know they can do it. And that lack of confidence leaves people guessing and also leaves people at risk for further three-dimensional scarring if you do not get the results you're looking for in a rapid manner. The standard of esthetician therapy is one of low confidence with cystic acne without pills. Products, for years they're saying topicals can't beat cystic acne, and that's because of this product failure. It's just consistent that they fail people with cystic acne. That cliche came from this high failure rate. Dietary approaches, you'll get some people that bring down their inflammation by changing their diet and their lifestyle. Other people will fail, and in hoping and waiting, many people will scar themselves with this approach. That's why it's not recommended as a primary approach. As a secondary approach, yes, eat well, eat healthy, and your whole body will thank you, of course. That should be obvious these days. The acne practice is extremely confident with cystic acne without pills, and it's not just a claim. We have captured the largest and most diverse acne gallery ever assembled, including many severe cases of cystic acne that felt like marbles under the skin. We've been able to clear them, we captured on video, and we're showing everyone the results. We are highly confident with any case of cystic acne. Please bring me the largest case of cystic acne in the world, and I will show you, using our daily interaction, how we'll bring you from point A to point B, and then we'll show the world the before and after results. Doctors, feel free to send me your most difficult and most severe cases. I will show you how this is done. More on efficacy. Confident with mini bumps. I put these mini bumps cases up here because a lot of people are suffering with mini bumps, stubborn mini bumps, despite having brought down their larger inflammatory acne. People find it to be even more resistant. Doctors are failing to even recognize this problem. Estheticians, some have been able to clear these mini bumps using several different procedures, but they still have trouble preventing new ones. And again, the estheticians are good at treating the skin, but prevention has always been the criticism here. They don't quite have the new methodology to prevent activity as well as patients need them to. And that's just been the classic criticism. Products, you're having failure. That's the whole reason we have this whole emphasis on stubborn mini bumps, is they're stubborn because the products aren't working. Dietary approaches, again, you're having incredible failures with dietary approaches alone for all types of bumps. Although I do recommend great nutrition, dietary approaches are out for your primary treatment. It's a side dish. The acne practice, we have recognized and coined the term mini bumps, and then captured the largest gallery of mini bump transformations ever seen. And you'll find that on the blog and in the homepage slider. So, if you take a look at this overall table, you'll see that there are many differences between the acne practice and everything else that has come before it. I just want to quickly go over all these checks and tell you how we hit these milestones. These did not come on day one, and they did not come easy. Let me show you. Enough time with patients and enough visits per month. This used to be done through just the email system, and eventually I would get bogged down. But since we started the video interactive robot, I've been able to give every member enough time and a sufficient daily interaction to resolve all concerns, regardless of the number of members who have joined. This is what makes the practice scalable and a solution to one of our biggest healthcare problems, is that we can keep taking members in and the technology online will keep resolving concerns regardless of the number of members in the program. Convenient, it's always been convenient because the service is at home and the products are at home. You see the doctor fast, we've always had that. Low cost, we struggle with that. We took a lot of criticism for the cost of the program for about 5 years, and because the business is small, we had trouble getting the cost down and still maintaining enough profit to keep the practice and the programming moving forward. Recently, I came up with the Acne Awareness Rebate, where clients just give a little bit of their story and I'm able to bring the cost down, and then their story can help spread the word of what's going on in the practice. So this was just this season, we ended up getting the cost down to $40 after rebate. And I'm very proud of this accomplishment. This has been something that's been bothering me for a long time, and I feel good about the new price and the new rebate. No discomfort, no embarrassment. It's always been like that. It's online service and online product. Proven new methodology. The video gallery speaks for me to the new methodology. We have the largest and most diverse acne gallery ever assembled, and if you look at it very critically, you'll see that it's all real and all untouched, and that there has been a major medical breakthrough here. Confident with cystic acne, again, the gallery proves it. I don't need to claim it. Confident with mini bumps, again, the gallery proves it. Irrefutably, I don't need to claim it. We have the super HD cases of those mini bumps, and thankfully, my amazing clients have captured their whole transformation in very high definition. So, in summary, the acne practice, the difference between the acne practice and everything else that's come prior is that we have new products, maximizing strength, and minimizing the irritation, or also maximizing the tolerability. And we have a new methodology that uses the daily interaction. This passion project and this innovation is where my medical journey and my medical career has landed. And I hope I'm bringing exactly what I intended to bring when I first set out on this journey. I hope you find satisfaction with your skin, and I hope you get from point A to point B. And if you're having any trouble getting there, feel free to email or call me anytime, and we will resolve any concerns in the bootcamp program. I hope this video helped. Talk to you guys soon, and thank you for all your contributions. You've made this project amazing for me. Take care. Talk to you soon.